Welcome to Connected by Health. I'm Dr. Krishna Madala. This is where medicine meets leadership, innovation, and humanity with one goal: to add value and help change healthcare for the better. If you believe health is about more than a diagnosis, you're in the right place. Today's guest is Superintendent Jason Perez of the Deer Creek School District in Oklahoma. As the district's chief executive, he oversees 11 schools and more than 8,200 students while driving a vision centered on academic excellence, equity, and whole child support. Under his leadership, I have personally seen how the district has strengthened partnerships with families and community organizations, and also invested in teacher growth and student wellness. We'll hear about the challenges of leading a rapidly growing, diverse district, lessons of wisdom from his distinguished career, and what's next for students and educators. So please join me in welcoming Superintendent Jason Perez.
Thanks. Glad to be here. Really excited.
Dr. Perez, can you please tell us a little bit about yourself and what made you want to go into education?
Sure. So honestly, I wasn't one of those kids who grew up dreaming of being a teacher. It really wasn't until I was in the Air Force as a survival instructor that I realized I enjoyed being in the classroom, enjoyed teaching, curriculum development, those sorts of things. And one thing kind of leads to another. Next thing you know, you're running a school district.
One of the things that I wanted to talk about today is Maslow's hierarchy of needs and how it applies to K-12 education. I've had a little bit of time to familiarize myself with it, and I was wondering if we could kind of go over it together.
Absolutely. It's one of those theories that you learn as a young teacher. And I will tell you, even though it's been around since 1943, it still applies today. I still rely on that theory in a lot of decision making. I think it still holds up. It still aligns with what we see in the world of education, but also what we're seeing in communities and cultures today.
hmm So, is it something that's commonly utilized within the K-12 education curriculum?
I think it is something, particularly with counselors, when we're looking at, you know, particular situations with students, it is something that we do reference. And I think it's something that as people hear, whether you're in the education world or not, and I know in the education world, it's like any other profession, there's so much edu-speak with acronyms and phrases and things that people that aren't in that field have no idea what you're talking about. But Maslow's is one of those things that really makes sense when you break it down for people. And the nice thing is it's a 5-tier hierarchy. So there's 5 tiers to it, and one just kind of lays upon the next. And when we're talking about how do we develop students in a way where they are strong learners, the Maslow's hierarchy of needs really speaks to that. I think I am blessed to work in a school district where we have a lot of family support, a lot of means for our students. And so for many of them, they're moving farther up that hierarchy so that when they're coming into school, they're more prepared to learn. But so many of our students in Oklahoma, especially, but also across the nation, are walking into the school doors every single day with backpacks full of trauma. And this theory really aligns with what we're seeing today. And so let's just kind of start at the beginning of this pyramid, down at the base of it. And when you think about just us as human beings, before we can do anything else, before we can enjoy a good book or be a good friend or be a functional worker, we've got to have our basic physiological needs met, right? I mean, that makes sense. Have you ever gone to a meeting where you're hungry?
Of course,
You're not really,
all the
yeah,
time these days.
you're not thinking at all about what you're in that meeting for or what you're learning. You're thinking about when's lunch. I know I'm like that. Same thing if I have not had a good night's sleep. I don't care how invigorating the presenter is, I'm going to fall asleep on them. So with this base of the pyramid is the physiological needs. So when we think about that, we're talking about the abilities for students to have those basic needs met: food, water, shelter, proper sleep, clothing. Without these things, there's just no way that students can focus on learning or engagement. And if we really want to kind of tie this into the state of Oklahoma, about 69% of Oklahoma students qualify for the free or reduced price lunch program, meaning that they are coming from homes that are having socioeconomic needs. And so this is a widespread economic need that's influenced. It's influencing access for food. Our large urban districts like Oklahoma City, like Tulsa, they have even higher rates. And that's also where the bulk of our children are in Oklahoma. So
Mhm.
when we're talking about how do we improve learning in the state of Oklahoma, you got to start with the basic needs. Are they being met? Because if they're not, you can put the most world-class teachers in those classrooms, and the kids are not going to learn because they need those basic needs met, just like you or me. They're no different.
Yeah.
And so then we move kind of up the pyramid into the second tier, which is safety needs. So again, this makes total sense if you think about it, is that when we're talking about safety, we're talking about the things that you and I would consider to be safe, is that physical and emotional security, stable home environment, health and well-being, freedom from violence, bullying, that instability at home, who's gonna be there? Do we have a home? And just general chaos that can happen. And so again, when we look at the state of Oklahoma, we rank 46th in the nation, 46th in the nation in child well-being nationally. So we're talking about low rankings in health and family context. Many of our children lack safety, reliability, those sorts of things. So again, how can a child really focus on learning if they don't feel that they have a safe environment? I know for me, I love coming home at night. This is my safe space.
Yeah.
And it's a reliable space. I know who's going to be there. I know the lights are going to be on. I know the heat's going to be on a cold day like today. But I also know that I'm surrounded by people that love me, and I'm an adult.
Mm.
Imagine if you're an 8-year-old, a 10-year-old, a 14-year-old, and you don't have those securities. How can you possibly function on thinking about education when you're just trying to, again, get these basic needs met?
No, definitely. That is a concern.
And so this also speaks to something else that's a little bit, it has to do with Maslow's hierarchy, but it's also something that we're really paying close attention to anymore in education. And that is looking at adverse childhood experiences.
Hmm.
And so we've really integrated these ACE tests into our counseling components of school. And so this is something that we use to kind of determine how many adverse childhood experiences children have had in their lives. And by adverse childhood experiences, I'm talking about things like how many have been exposed to violence, have experienced homelessness, have parents that have been divorced, have experienced physical abuse, sexual abuse, emotional abuse, so many different things. And so through a quiz, we can kind of determine what somebody's ACE score is. And obviously, what we want to shoot for as parents is a zero. We want a kid to
Hmm.
have zero adverse childhood experiences. When we look at that in Oklahoma through the Oklahoma Youth Risk Behavior Survey, what we found is that the students who actually participated in that survey, 28.8% of them had a zero on their ACE score, which is awesome.
Good.
But let's go to
Good.
the
Good.
far end. 9% of the students who took this survey had an ACE score of 4 or higher, which is significant. And so what we're seeing is that for our children, 67% of them report being verbally insulted or put down by a parent or an adult. 36% live with somebody with an alcohol or drug problem.
Hmm.
40% live with someone who's depressed, mentally ill, suicidal. 29% reported physical abuse at some point. 19% saw serious violence, like somebody being stabbed or shot in their neighborhood. These are the things that our children are dealing with today. And I think it's
Hmm.
important that we highlight these not as excuses for why academic performance may be low, but to recognize that it's not simply whether or not that they can just add or subtract, or whether they've got a certified teacher, or whether they've got, a fully funded educational system. There's a lot to it. We've got to look at our community as a whole when we're talking about the
Hmm.
health and well-being of our children. So going back to Maslow's hierarchy, and we get to that third tier, where now we're kind of getting into the pieces that, it's where we've moved out of those baseline things we need to survive. And now we're getting into love and belonging. And
Hmm.
those are needs that obviously are important. Social connections, friendship, family support, acceptance at school. These are the
Yeah.
things that I think we see schools trying to really push on to try to be able to help. It's things they have a little bit more control over. In many high schools, they have started to do a process where they look at every single student and determine whether or not they're participating in any extracurricular activities, because studies out there show that when students are connected to something in their school, whether it's sports, whether it's clubs, whether it's band, if they're connected to something, their chances of graduation increase significantly. In a study that was conducted, what they saw was that white students that were participating in no extracurricular activities had a 70% chance of graduating. If they participated in even one extracurricular activity, that jumped to 87%.
Wow.
Pretty significant. For Black students, it
Mhm.
went from 62% to 79%. And for Hispanic students, it went from 75% to 82%. So that's something where schools can really like target in. And if they see that, hey, Jason is just not really, he hasn't found his people. Okay, let's find a way to help him find his people. Maybe he's not a football star. Maybe he's a guy that really enjoys chess or Dungeons and Dragons or can sing. Let's find out, let's connect him. And when you're connected, then you're part of that community and you feel that sense of belonging and love. And these things, what they do is they lead to lower absenteeism, lower dropout risk, more engagement. Those are important pieces. And so it's not just about that family support, which is important. And we need to make sure that that's a key piece, but also what we can do in schools to be able to help. So then as we move up the hierarchy and we get to the fourth tier, almost to the top of that pyramid, we get into esteem needs. So self-esteem. Obviously, confidence, respect from other people. These are the things that help students feel capable and valued, and they're likely to persevere through challenges. We talk a lot about grit, I think, in society anymore, but we don't really know what we mean by that. That's what we're talking about, is that are we
Yeah.
building enough esteem in children today for them to be able to have grit, to learn how to persevere? Are we bailing them out too quickly? Are we heaping praise on them? Sometimes I think we go on both sides of the spectrum on that. We're either heaping too much praise on them for doing the minimum, or we don't give them any praise whatsoever. And without those things, we can't build that self-efficacy in them to be academically successful. And when we look at Oklahoma, given our lower statewide investment per student, we're ranked 49th in the nation for our per pupil expenditures in
Mhm.
education. This leads to poor education outcome rankings, but it also, what it causes is a systemic barrier to resources and supports for students that are in poverty. They don't have access to the things that can help build self-esteem and confidence and give them those mastery of tasks for them to become successful students. And so, and then we get to the very top of the pyramid, and this is that self-actualization need. This is where you want your children to be at, is that's where they're achieving their full potential, they're creative, they're experiencing personal growth, they become lifelong learners. And you do this by achieving everything below Maslow's hierarchy of needs. You've got to
Mhm.
accomplish all those other things to get them to self-actualization. But if you can get them there, then we've got the learners that turn into the leaders of our country. But you can see it's not just a matter of putting in legislation that's going to force kids to the top of that hierarchy of needs. So we got to do the dirty work. We've got to provide the supports at the basic levels and work our way up to get to
Mhm.
that top tier self-actualization. And so that's where, when I think about where we're sitting at with education in Oklahoma, and we're thinking about all of that, it really goes right to the whole point of this podcast, which is looking at the health of our
Mhm.
students.
Yeah.
Where are we at with really focusing in on that? And as an education person, hey, I can tell you I would love more funding. But I can also
Yeah.
tell you that if the legislature came in and said, hey, we're going to take $1 billion and we're not going to give it to education, we're going to give it to social services. We're going to start doing the things that meet those bottom tiers of Maslow's hierarchy of needs. I'd be the first one to say, do it.
Yeah.
Because I think you get those things, it's going to make my job easier.
Well, I mean, definitely, and this is a very important concept, and I felt like when you want to talk about this, I really didn't know much, but the more digging I did, I was like, oh my God, no, this is really important for a lot of different reasons, but most importantly, you hit the ball out of the park. You have to start at the base, and you really have to work your way up, right? And it's really sad. Oklahoma's a great state. I grew up here, lived here most of my life, and unfortunately, we're seems like we're at the bottom tenth of everything, and especially the two most important things. What I feel are number one, healthcare, and number two, education. And it's really important for us to, I think, as a state, to look at how are we going to get ourselves out of the bottom 10. And the answer might be simple. It's fund us more, provide more funding for education, provide more funding for healthcare.
which is
But
never simple in Oklahoma because to do that, we've got to make sure our tax base is fulfilled, and we don't like taxes in Oklahoma. We're
exactly.
very anti-tax. Now we're not recognizing the fact that, you know, if I put $1 in to help feed children, that's not gonna go
Hmm.
very far. But if
Yeah,
you and me and 50 other people and 100 other people do it, now we're beginning to we can get a bag of groceries. We can get much more for children if we're for that same $1.
exactly.
Uh, but instead, we're looking at like, how can I keep my dollar? Well, I look at that dollar as I'm not giving it away. It's an investment in
Hmm.
our state. If our health standards improve, if our education improves, our whole state improves. And you're right, this is a wonderful state, and
Yeah.
we deserve to be able to be in those top tiers. But we've
Hmm.
got to put in the work. We've got to be able to invest in our citizens, and especially in those that have the most need.
Yeah. No, definitely. Real quick to review the Maslow's hierarchy of needs. So at the bottom, at the base, you have the physiological needs. Then you move up to safety needs at the next level, and then you move up to love and belonging, and then you move up to esteem, self-esteem, and then from there, the top of the pyramid is the self-actualization, right?
Absolutely.
For those of our listeners, that's how the pyramid is stacked from the bottom to the top. This is a phenomenal concept, and I really can't appreciate you enough for breaking it down for us. I really appreciate that, Dr. Perez. We could talk about this all day, but there's a couple other questions I wanted to go over. As you know, I'm in the healthcare field, and one of the things that I also feel very passionate about is about education and how important it is for our K to 12 population to have a variety of different experiences, but also to have the best care that they could get so they could continue to grow and continue to be the leaders of our country in the future. But I wanted to first start off with how are school health services funded and what funding gaps actually exist right now?
So it is tricky because sometimes there are grants available. Sometimes we're able to use federal money to be able
Hmm.
to provide some of those health resources. But a lot of times it's based off of the local school district's budget to be able to do that. So, for instance, in Deer Creek, we do have a nurse in every school. And now, granted, not all of them are RNs. We've got some LPNs. We've got a couple of RNs, but that's a plus because I remember not that long ago when I worked in a different district. There was one nurse to rotate between 5 schools, so you get a
Hmm.
nurse one day a week. Now, when I think about looking at like Oklahoma City and Tulsa, which are more urban areas, for some of them, they have a few more options available where they may be able to bring in clinics, like community clinics that can do like dental checkups and doctor's appointments and some of those things like that, which is amazing to be able to have those types of services. But a lot of times those are grant based services that come in. And so from year to year, you might have them, you might not have them. And then as far as like mental health too, that's very limited. It's definitely not enough out there to be able to really provide that support that's needed at the schools. And for our families that want to try to get their kids that kind of support, I will tell you, they have a hard time too because they can't get to a counselor, to a psychologist, what have you, because they're booked solid. It's so difficult anymore for families to even get that mental health support. And that's the one thing we see skyrocketing anymore is really mental health.
Okay. So, in terms of the rising mental health needs, what component is spent in terms of addressing bullying among students?
And so for bullying, usually that is a district or a site-based initiative process
Hmm.
that goes through. And I know that that comes up a lot. And I will tell you that when I look at administrators across any district, I will say this is an area that they do take very seriously, and we strive at the district level to be able to put as many safeguards as possible into those things. I tell you, it also becomes more difficult with social media
Hmm.
because so much of the stuff that we think about the old days when we thought about bullying was, the big kid, picks on the little kid and throws him in a trash can. It's more sophisticated than that. What's really happening is it's happening out there in social media land and AI and all these things that allow all kinds of different forms of bullying to exist. And when those things happen outside of the school day, they still affect the school day. And so building principals have to still do all the investigations on that. And those are things that can pull resources for hours upon days to be able to kind of investigate and try to root that out and then be able to find the best way to handle those situations. So it's become more complex, if anything. But it's never something where I feel like anybody tries to just push it under the rug. They're trying their best to be able to sort that out because when bullying occurs, it dampens that culture of that school. And again, going back to Maslow's, if they don't feel that sense of belonging, they're not going to learn.
Yeah. It's been a while since I've graduated high school. I'm not too old, just to all of our listeners out there, but I really didn't realize that when you talked about social media bullying, and it really is a serious. How do you devote resources to kind of figuring out the truth? Thanks for mentioning that part. Yeah, as you know, I work in the healthcare field, and one of the most I feel the most defining moments of my life was being a resident physician during the COVID-19 pandemic. And I feel that's the pandemic has really changed a lot of things, a lot of the things that we do, whether if it's healthcare, education. But in terms of learning from the COVID-19 pandemic, what lessons that you've learned during the pandemic changed your approach when it comes to outbreaks and infectious disease prevention in schools?
You know, I wish I could say we didn't take it seriously before, but when I think about like even something as basic as the flu, if
Hmm.
we saw a flu outbreak taking place, we did a lot of the same protocols. We would significantly increase cleaning in the schools. We would notify families to make them aware and try to offer up tips and things to be able to kind of help them. I think, one of the things that has changed is definitely the stigma behind wearing a mask. Because I remember well before COVID, one student that wanted to wear a mask and it completely perplexed everybody as to like, wait, can they do that? And you're thinking in terms of like school safety, like, well, if they wear a mask, are we going to be able to identify who they are? And just this whole thing around just one student wearing a mask. And then, all of a sudden it became everybody wore a mask. And so now when a teacher shows up in a mask or students show up in a mask, it's almost like you're kind of recognizing that like, hey, thanks for looking out for everybody else when you're doing that. Even in my house, I had strep throat last week and the rest of my family did not. So if I was going to be in a common space, guess what I was wearing? And if
Yeah.
I hadn't, I probably would have been exiled by my family because they didn't want to get strep throat. But so I think that like when it came to the health piece of it, while I think that we've always taken those sorts of things seriously, I would say the one thing that changed probably that I'm disappointed in is the politics around something as simple as vaccination
Mm.
and taking something that we pretty well had a good handle on and making it way more complex now, which, as we're beginning to see across the nation, is leading to some new health issues that have been since extinct for a long time.
Hmm. Yeah, we're really worried right now about the measles outbreak in South Carolina. I know we had one in West Texas, and of course Central Texas, and a few cases here in Oklahoma. There was just one isolated incident a couple of days ago in Norman, Oklahoma, at a restaurant. And so, what's really sad from from a public health perspective is a lot of these infectious diseases are preventable illnesses, and they do place a significant toll on the healthcare industry. And I don't really think people understand that. The amount of effort that it goes to just contact tracing for one TB outbreak or one just measles outbreak, it's a lot. It's a lot of effort, and it's a lot of pulling of resources that may and could be used for more urgent needs and for more chronic illnesses needs. And that's the sad part. We're planning on trying to do an episode in this podcast about looking at the economic and the fiscal ramifications of a vaccination and how much money vaccinations do save in the long run. But the other thing is a lot of people don't, I think, understand this component, which is vaccinations are probably one of the most important contributors to the doubling of the human life expectancy in the last 150 years, and people don't really realize how difficult it was growing up with polio or how difficult it was growing up with hepatitis B. But we'll talk about all that in a later episode. But when it comes to vaccine policies, do you in your district have any exemptions, or how does the process of exemptions work when it comes to
We do
vaccination?
have exemptions, and these are things that, it's state law now.
Hmm.
So whether myself personally, which I totally agree with you, that when I think about vaccinations and just what they've done as far as improving mankind,
Hmm.
I'm all in, but there are exemptions that are allowed, and it's really, honestly, it's not all that difficult. If somebody says, I don't want my child to take the required vaccinations, they fill out a form exempting
Hmm.
them. And it's because it can be based off of religious reasons, which has always been a thing.
Yeah.
But then there's also just the personal, I just, choose not to vaccinate my child, which I remember in the earlier parts of my career, like that wasn't an option because it's kind of a thing where, well, if you've got, 3 or 4 kids that aren't vaccinated, it could impact everybody. Um,
Hmm.
Sorry, everybody gets vaccinated,
Yeah.
but now that's not the case anymore. And so exemptions are a common thing, unfortunately, anymore.
I guess the concern that I have with when it comes to vaccine exemptions is it's done on a state by state scenario, if I'm not mistaken, right? Is there any benefit to doing it on a state by state scenario? Because I've always wondered why there couldn't just be a national structure when it comes to healthcare for the United States. And the reason I say this is during the pandemic, you had 50 individual state health departments, and it made communication a lot more difficult. It made administrative burden a lot more tedious because now you have to communicate with 50 other health departments. And so I was just curious, were there any in the education field, are there any talks of nationalizing like a vaccine policy, or do you think we'll ever be able to get there?
I don't know if we could ever get there. There's a part of me that I get what you're saying because I saw that same battle during the time with COVID. Everybody's got a different opinion, and you can't get everybody to kind of coalesce, and it causes confusion amongst the population.
Yeah.
And so, nationalizing or having one set practice, it would make life a whole lot easier. My biggest fear is, what if it's the practice that is not the most medically sound?
Mhm.
Because it's like, again, it's become a political issue more than anything else when you see, why this state doesn't allow exemptions and this state does. It's not
Mhm.
rooted in science, it's rooted in politics. And we're not thinking about what's best for we're not listening to experts as much as we used to, that was the thing before. I mean, shoot, if the CDC told us something, that was the gospel and we all followed it. And now there's so much doubt in that that's unjustified. And it's really unfortunate because people have no clue, how much work
Mhm.
goes into taking the concept of a vaccination and actually making it a reality. This is not something that happens in 30 days.
Mhm.
The amount of clinical testing, I mean, it's mind boggling how long it takes to get to that point. And to think that like that was done without the best minds in the country or in the world helping to develop these things is just ridiculous. And so while I would love to be able to see something more nationalized, my greatest fear would be that that nationalization would be leaning toward something that's not the best for our
Mhm.
citizens.
Yeah. And like you said, I wish it could be done in 30 days. I really do. I really do wish that it was that easy, but by no means it's not. I feel personally that educators are very important to our society. And unfortunately, I also feel that educators are not paid or given the due credit that they should receive for shaping the future of our society. And so, you've had a distinguished career, and I just wanted to know if you had any words of advice for any of our listeners that are wanting to get into education.
My best piece of advice is do it.
Mhm.
Because when I was a teacher, and reflecting on that time, I truly believe that that was the most important job in the world. It is the job that makes all other jobs possible. And if you are a
Mhm.
great teacher, you get to have an impact on lives on a daily basis. My wife is a teacher, and be honest, I get jealous hearing about her relationships with her students. You know, she impacts them every single day. And it's something that is very unique and it's a real blessing and every single job has hardships. I don't care what you do. And it's every job feels undervalued and I understand that. And I think that you find yourself a school district, you find yourself a school, you find yourself a principal, somebody that you're like, hey, I can learn from this person, I can make a difference in this area. And then you go do that and you go make that difference. And you will find that if we're not so caught up on like, I need to have a lavish lifestyle. I'm not saying that, teachers need to be paid more. I think that it
Mhm.
is preposterous that you have an educational professional in the state of Oklahoma that can't afford to buy their own house. I think it's
Yeah.
preposterous that an education professional has to work a second job in order to be able to have a family, to be able to pay childcare. Those things are unacceptable. We should be respecting them more. And I'm not saying that every teacher needs to make a $300,000 salary. I'm just saying, and they're not looking for that either. And so I think the people that are considering education are doing it not for the glory. They're looking to be able to make a difference. And if you want a career where you are making an impact every day. Education is the one. And I've been trying to tell people too now, as we look at this new generation of workers coming up, is that these are individuals that want to be able to have an identity in their career, but they want to have an identity outside of their career.
Mhm.
And I think that you can do that in education now. I think that there is a way to be able to have that work-life balance where you can go and make that difference, and then you can hang it up at the end of the day, and you can go be a father, you can go be a friend, you can be a dog owner, you can be in a band, you can do different things too. And so set all the rhetoric aside, set all the politics aside, because when it comes down to it, it's you and your school. And
Mhm.
and you can make that difference still every single day.
Uh, Final question, and I may be opening up the Pandora's box with this, but this is just one I kind of thought of as we were talking today. Obviously, AI, artificial intelligence, is coming up to becoming a game changing in many of our lives. And so the question I wanted to ask you is how do you think AI is going to transform the future of education, specifically in the K through 12 population?
I was talking to somebody not that long ago who's way more intelligent than me in this area, and he said that we are kind of just in the beginning stages of AI,
Mhm.
that what we're seeing right now is kind of like back when the internet first came out. And, we were, well, you may not have been, but using AOL and thinking, wow, this is just this earth shattering thing. And now we kind of look back on it and going, oh my gosh, dial up internet and the way that America Online worked and all that stuff, that was so archaic, but then it
Mhm.
was groundbreaking. But now you look at where we're at with the internet compared to then, and you just can't even tell the difference. I mean, it's night and day. And I think
Yeah.
that's going to be where we're at with AI, is that there's so much power to that tool. And my biggest fear is, are we going to run away from it? Or are we going to try to find a way to embrace it and make it work in a beneficial way for us? So I would like to lean toward, like, we have this tool. Let's figure out how we're going to be able to make this thing work. I think what we're beginning to see in Oklahoma is this shift away from technology in schools.
Mhm.
I do understand there was probably some abuse in the way of how we were using virtual learning in the public schools. And now we've pushed so far that we're not allowed to do virtual learning anymore. I
Mhm.
think that people have started talking about screen time. And of course, we're now banning cell phones at school, which I'm totally on board with, perfectly fine. But now that's led to people saying we shouldn't have Chromebooks and MacBooks and iPads in the classrooms anymore. And I think what we're doing now is we're setting up this generation of learners who they are digital natives. They were
Mhm.
raised with this technology. This is what they know, and we're taking that tool away from them. It doesn't, that to me, that doesn't make any sense. I do think we can learn how to have balance. And I think we already have balance in schools, to be perfectly honest. But when we start fear mongering something like technology, we're not doing a service to this generation of students that are going through our schools. And so when it comes to AI, let's learn how to embrace it. Let's learn how to be able to make it a tool that our children can use in a real productive sort of way.
Yeah. We do live in the digital age, and it's really important for our children, by the time they're out of school, to be able to utilize and apply technology, and not just in their daily livings, but even just to make a living, right? It's really become such an important component. I remember struggling to learn cursive for myself when I was in first grade and second grade. But my kids, I feel, would have to do the same thing, but with coding. It's a new age, and digital access to digital technology and compatibility to digital technology is going to be a learned but required skill in order to maintain a decent living, I feel like, in the future.
Well, now it's my turn to open up Pandora's box and ask you,
Uh,
how often do you use cursive writing on in your daily life?
I really don't. However, I will say this, I'm a little bit old fashioned. If I'm ever writing a letter or thank you note for someone, I usually tend to write to some degree in cursive. And that doesn't happen on a daily basis. It happens, at least on a once every monthly basis or so. But I do
Well,
use
and
it
you're a
though.
doctor. You probably have terrible handwriting, so
Oh, I do. And then the cursive makes it easier to hide that fact. That's why I tend to write in cursive, because they're like, I can't read this. Oh wait, never mind. He's a doctor. But
well,
it is a trick that I've used to hide my horrible writing skills.
Well, the topic of cursive is one that comes up a lot in education, and I don't know if I'm in the minority anymore or what. I honestly thought by this point we would be done teaching cursive.
Mhm.
and that will have moved into more and more with keyboarding or coding or those sorts of things. But sometimes there's a push to keep those generational aspects of education in place, even though I don't ever write in cursive. Even
Mhm.
my signature is just nothing but scribbles. That was the military part of me. But so when I look at that for our children, it's still part of our curriculum, so we still teach it. And I get that there is a component of that of like, well, it allows you to use different parts of your mind. But I still am always going back to how are we preparing everybody to be the best or to be workforce ready? And I
Mhm.
don't know if cursive is one of those things where I would gladly give that time up in order to focus more on technology skills for our kids. Cause I think that that's the stuff
Mhm.
that is going to be what they need for this
Mhm.
future that we don't know what it looks like just yet.
Well, that is a very unique perspective, but I think it's a perspective that is really going to be needed if we want to prepare our children for the better future. But Superintendent Perez, thank you so much. Really appreciate you coming on board and answering all of our questions. And we'd love to have you on again down the road. But once again, thank you so much for being here today.
Well, thank you for the invite. And yeah, call me anytime. I am always happy to talk.
If you found this conversation valuable, share it with someone who could use it. And if you're on Apple, we'd love to hear your favorite takeaway in a review. See you next week.